Hello, everyone. My name is Matthew, and I will be presenting on genetic contributors of efficacy and adverse metabolic effects of chlorthalidone in African Americans from the GenHAT study, which studied the genetics of hypertension associated treatments. In this study, we are looking at hypertension, which refers to elevated blood pressure. This is a major factor for cardiovascular disease. Reducing your blood pressure is very important, as studies that focused on treating lower blood pressure and maintaining that level showed less chance of heart failure, stroke, and angiotensin stress, so clotting and blocking of the arteries. And this led to a decrease in deaths from cardiovascular disease by 27%. So blood pressure control is particularly important in the African American population because they show an earlier and more prevalent onset of hypertension compared to people of European ancestry. Throughout the article, we're referring to Black and white populations in the US as African American and European American because of the ancestry from those continents. Now, compared to European Americans, African Americans actually have a low response to beta blockers, angiotensin converting enzyme inhibitors, and angiotensin receptor blockers. And this is important because the beta blockers refer to blocking receptor sites for adrenaline and norepinephrine. These two hormones will increase blood pressure in response to the sympathetic nervous system telling them, okay, reduce the size of the blood vessels for the fight or flight response. And the angiotensin converting enzyme and angiotensin receptor blockers refer to blocking angiotensin, a peptide hormone that will constrict blood vessels. This is referred to vasoconstriction and increase blood pressure. Now, however, African Americans have responded better to thiazide diuretics, which this will reduce how much sodium is reabsorbed through the kidneys. And this will allow sodium to be filtered more with urine. And this will reduce blood pressure because higher sodium does lead to elevated blood pressure. And they also respond better to calcium channel blockers. And this is important because calcium actually raises your blood pressure. So calcium channel blockers will reduce the flow of calcium and allow those blood vessels to relax. This is referred to as vasodilation. Now, the purpose of the experiment is to just examine African American responses to first-line antihypertensive treatments, such as those thiazide diuretics and calcium channels. And this is important because of precision-based studies needed by clinicians, policymakers, and health systems for public health. These main groups want to look at how we can raise overall standard of public health in the US and how we can help populations today, especially with an ever-changing environment where we are trying to be more inclusive and more diverse in how we respond to patients. African Americans have historically been underrepresented in these pharmacogenetic studies of antihypertensive treatment, and they've also been left out of genome sequencing and genome-wide studies. And this response has not been undertaken with the African American population. In fact, data from the genetics of hypertension-associated treatments identified genetic variation in antihypertensive treatment of chlorthalidone for 4,300 African American participants over a half annual period. In this study, data from the genetics of hypertension-associated treatments to identify genetic variation in antihypertensive efficacy of chlorthalidone for 4,300 African American participants over an annual period was used to find how chlorthalidone responds to genotypes and genes that sequence for heart and the blood vessels. Researchers also considered how genetic variation can present itself in fasting glucose. The glucose when you have in your body after it hasn't eaten for 2 or 4 hours to see your more stable glucose levels. And this could be due to chlorothalidone heightening of glucose levels. So the methods that the researchers used were they collected almost 7,600 participants, and they were randomized to treatment with one of 4 primary antihypertensive drugs: chlorthalidone, amlodipine, lisinopril, or doxorubicin. 320 participants were treatment naive. They never received treatment for hypertension prior to the study. So they were particularly interesting for more sensitive studies to see how someone who doesn't have tolerance to these drugs will be affected by chlorothalidone, to these primary antihypertensive drugs. For chlorothalidone was given daily, and over the course of the study, participants were given decreasing doses of the drugs. 82, almost 4,000 participants had baseline and 6-month blood pressure measures. Genome-wide genotyping was performed using Illumina Infinium multi-ethnic B-chip arrays, and 96,857 variants were used in amputation, analyzed from strand concordance, position, and allele assessment. Genetic epidemiology of response to hypertensives and the participants were randomized to hydrochlorothiazide in PARA and JIRA. In PEER 2, participants were randomized to chlorothalidone. Washout period at least 4 weeks to establish hypertensive blood pressure before starting the drug treatment made these populations comparable to the secondary treatment naive population. Replication significance was tested at alpha 0.025 divided by the number of significant independent signals. Suggestive variance tested at alpha 0.05 divided by the number of independent suggestive signals. And so you can see the charts here so these 2 charts show you the demographics used. As you can see, it was predominantly female. Most people were around 66 of age, some 7 years older, some 7 years younger on average. And the BMI was around 30, was around 24, could range from 24 to 36. And there was a lower amount of smoking. There was a reduction of nearly 6.7 milligrams per mercury, something like that, for SBP, and 3.1 milligrams per mercury. For fasting glucose, there was an average increase of 6.7 milligrams over 24 months. For the onset receptor of treatment, larger responses were observed. So there being almost 20 decrease for systolic blood pressure, and a 9.4 decrease for dialytic blood pressure, and 10.3 milligrams per liter for fasting glucose. Manhattan plots for the primary discovery analysis for blood pressure response are presented in Figure 1. The treatment naive analysis results are shown in Figure 1 as well. The genomic inflation factor from the individual's notes and show evidence of systematic inflation. Table 3 represents the top 14 variants associated with chlorothalidone blood pressure response. 4 of these variants met this statistical significance criteria after Blanfenoride correction. The GenHAT carries on average observed a reduction of 6.79 millimeters per mercury over 6 months compared to an increase in blood pressure with the carriers of the A affected allele. The person's homozygous for the affected allele G observed a 4.19 milliliters per mercury reduction in blood pressure compared to a 2.52 reduction compared to those homozygous for the A allele. So these figures show a chart of primary discovery analysis for blood pressure response. That red line at the top is representative of genome-wide significance. 2 intergenetic variants located downstream of FZD1 were marginally associated with DB response. 3 variants were located within an intron of the CA-CNN A1C gene. with an additional CNA1 intronic variant reaching suggestive significance. 19 suggestive intronic variants of LTBP1 treatment group SB response analysis. The margin of replication in favor for 4 of these variants with the same direction of effect. 4 variants had marginal association with change DV in the intergenetic region between crystal 2 and efficacy for treatment naive participants. Genetic variants associated with the BP response to chlorthalidone may help improve treatment outcomes. 8 significant variants associated with blood pressure response. For dialytic blood pressure response, most significant region was located upstream of CDH9. CDH9 was previously implicated in coronary artery calcification, and 3 significant variants in CAC and A1C involved in several physiological processes, including vascular and smooth muscle contraction, important in blood pressure regulation. And thank you so much for listening to my presentation.